All right, Mr. Tyler, we've finished your head-to-toe assessment. We've done an EKG on you, and we've drawn some blood work. One thing I wanted to go over is something that you revealed in your family history while discussing with me. You said that your father had had a previous history of polyps seen on a colonoscopy, correct?
Yes.
Okay, well, that increases your likeliness of colon cancer in the future, which means that there are some steps that you need to take, and I need to take as your primary care physician to prevent worst case scenario, which would be colon cancer. I want to talk to you about some resources I've found. Colon cancer is just malignant growth of cells within the colon, so it's sort of like any other cancer, although it's found specifically in the colon. There are several treatment options if that were to happen, surgery being one of the greatest preventions. However, before we even get to that point, you can be screened earlier in life. And the earlier you get your screening done, the more likely we're able to prevent the formation of colon cancer. So there are some different screening tools. I want you to be able to look at this tool that I have with me. Some screening options available to you are going to be, you can do a fecal test where you would give a sample of fecal matter and they're able to test it and see if there's anything malignant within that. You can do that annually. You can give a stool DNA test. That can be done every 3 to 5 years. Those are 2 stool tests that can be done. Direct visualization tests, which are the preferred method because they're much more accurate, are going to be a flexible sigmoidoscopy. That can be done every 5 years. And that's, however, the only drawback to that is that it's only looking at the sigmoid part of the colon. It doesn't go any further. A colonoscopy, that can be done every 10 years. That looks at the entire colon. And then a CT of the colon can be done too every 5 years. Now, normally, patients don't have to start screenings until they're 50 years old. However, you have a previous familial history of polyps, which in a first-degree relative from your father, which makes you at a higher risk for developing colon cancer. So we would ask that those screenings start earlier for you by 5 years, so about the age of 45. Now, before you write that off until you're 45, I want you to consider some of the signs and symptoms of colon cancer so that I'm not just leaving you today telling you need to wait 15 years before getting screened. You're going to want to look for things like abdominal pain, rectal pain, blood in your stool, pencil thin stools, unexplained weight loss, any changes in your body that don't feel right. Always come back. We can run blood work, but because of your family history of polyps, that's going to be something that's a red flag for us. It's going to be on our radar. We're going to test and screen for those things earlier, okay? One thing I'm going to send you home with is a print off of this screening options. I'm also going to send you home with a print off of some of the online sources that are available, the CDC, the American Cancer Society, Johns Hopkins. They all talk about different screening options, when to be screened, how to be screened. Something that people really love right now is to do the Cologuard at home. That is a screening option. It's similar fecal test. One thing about the Cologuard is it's not always super accurate. It can give false positives and false negatives. Another drawback to Cologuard is that your insurance is going to count the Cologuard screening that you send in as a visit to the doctor. So if you get back a positive or a negative result and you want us to take another look at it, that will not be covered under basic insurance plans. So although Cologuard is an option, people love it, it's readily available at home, it provides you with the ability to stay at home, something that is fairly intimate, you can do yourself, but it's not always so accurate. So I do caution you on that if in the future that's something you want to try. You can never be screened too early. If you ever got nervous, it's something we could do, but you really don't need to do it until 45 unless you're having any signs and symptoms. So I would love if you could affirm for me some of the things that you learned. Can you tell me what age you would need to be screened at due to your family history?
45.
Yeah, can you tell me some of the signs and symptoms of colon cancer that we would want you to be looking out for?
Blood in your stool, abdomen pain, pencil thin stools. I think that was it.
That's great. Yeah, and any rectal pain, anything that's going on down there that doesn't seem right, we would want you to come back in and we can take a look at those things, okay?
Okay.
Do you have any further questions, or do you feel confused about anything, or do you want me to re-go over anything?
No, that's super helpful. It's good to know that I need to get screened earlier than 50.
Yes. Many people don't realize that a first-degree relative with a history of polyps or any abnormalities on their screenings or colon cancer increases their chances. And as an American male, 1 in 23 American males are diagnosed with colon cancer. And it can also be affected by your diet. Now, we live in Louisiana. High fat, high alcohol, low fiber diets can affect your colon as well. So I want to encourage you things like the Mediterranean diet, high fiber diets, high water intake. Don't strain while you're using the bathroom. If you ever had any issues with constipation or the inability to pass a stool, we have things that we can do to prevent that. We don't want you straining. Another interesting fact that I have found during research and in clinic is that as patients sit on the phone, on the toilet, on their phones, that can also increase rectal pressure while they watch videos or scroll or even watch the news. It's not necessarily bad things that are happening, but the longer people sit on the toilet on their telephones, it can increase rectal pressure, and that can also affect your colon. So I just want to make you aware of that too, as the rising world of social media kind of affects our attention spans. We don't really want you sitting on the toilet for any extra periods of time either, okay?
Got it.
Okay, if you need anything, you can reach out, call us. We're going to send you to the front, and you can pick up all of the resources that we have for you there, okay?
Awesome.
Thanks for coming in.